So very good evening, member, to a demo session of MCC ECG learning program. Myself, Dr. Amit Arora, and I will be your host and tutor during this program. And I have experience of 7 years of online teaching, and we have thousand. I have taught thousands of students, right from the mostly MD to even at the age of 60 years, people comes to learn ECG from this program. Okay, so we have a largest community on Facebook with the name of Medical Case Consultation. It's around 6 lakh member, and I started it 7 years back. So previously these kind of facilities were not common, Zoom and like that. So we used to share the knowledge on platform. But now due to advancement of technology, we have started various programs like basic programs. So first thing is, first question arises. Yes, MCC is the largest community in the world. Yes, Dr. Srihari. So I have created this community, and most of the people who come through Facebook ad may not be aware of me, about me, but a lot of are there who know about me. So members, first thing is why every doctor, irrespective of his specialty, should know ECG. Can anybody tell? We should have a two-way interactive manner discussion. Otherwise, it look like आप तो वीडियो देख रहे हो YouTube पे देख लो जाके, है ना? जब लाइव सेशन कर रहा, आपने भी टाइम spend किया है. I have also spared the time, important time. So let us make it two-way interactive conversation. So please participate. Don't get shy. Okay. You people can comment on social media. वो तो मुझे पता है, बहुत कुछ comment कर देते हो. But यहाँ पे सामने आके mute, just mute. Why? A lot of people might have seen me on the ad, on either on the Insta or the Facebook ad, through Facebook ad, and now you are, we are meeting face to face. So, members, I would like to tell you that we have entered a post-pandemic era, and where the heart attacks and strokes are becoming more common. And in 2023, a physician clinician, irrespective of his specialty, should have extra clinical skills. Nowadays, a lot of programs are available. Like every clinician should be expert in interpreting ECG, X-ray, CT scan. So we conduct only ECG, X-ray, CT, and echo program. But at least a doctor, because suppose some patient come with an ECG, and he know that he has some problem, atrial tachycardia, due to he or she get palpitation, and you are looking at the ECG and like this. So patients are more smart, becoming more smart, because they have Google. They come with everything. They know that they have this disease. They will come to you with more knowledge. पढ़ के आएंगे बहुत सारा कुछ, ठीक है? So you should be more skilled. And a skilled person who has a multiple skills are able to manage the patient in a better way. Okay, so ECG is a very important thing. It is a life-saving thing. Suppose patient is having a cardiac arrest, and you are sitting here waiting for this and this. You are not able to even diagnose cardiac arrest. There are 4 rhythms of cardiac arrest. Don't know, तो फिर तो आपको डॉक्टर की डिग्री को फाड़ के फेंक देना चाहिए. Because if anybody of you ever revive a patient of cardiac arrest, उससे जितनी खुशी मिलती है उतनी कहीं नहीं मिलती आपको, ठीक है? When you कहीं पे भी आपने कोई cardiac arrest में patient है, immediately you have उसको assess करके, basically BLS course, ACLS course are there, होते हैं, बहुत से doctors भी करते हैं, nurses तो करती हैं. So if your knowledge, if you have ever survived any patient, so it's like giving a new life. Okay. So as an emergency physician and as an OPD work around, everywhere, these kind of skills are very, very important. And according to a survey, it is found that even more than 70% doctors are not expert in ECG interpretation. I am saying this, मैंने आप सब ग्रुप में जब पहले आए होंगे, मैंने बहुत इजी सी चीज पूछी, कैलकुलेट द हार्ट रेट, जस्ट टू चेक योर क्लिनिकल स्किल्स, कि आपको एक्सपीरियंस कितना है, बुकिश नॉलेज, आई डोंट नो बुक, मैं आई नेवर teach from bookish knowledge, I don't have any PDF, whatever is there, I will speak from my experience and what I have gathered, learned from my 7 year of experience. So I have gathered, I have real clinical cases, I have collected files, ढेर लगा हुआ है, ठीक है, उससे मैंने एक प्रोग्राम को डिजाइन किया है, because what happened, ECG is difficult or easy. So let me share the screen. Let me check who is present. Okay. So first question arises, ECG is easy or difficult? So most of the people, some of might have learned ECG from books, and when you read from a book, it is given in very easy manner. Everything is Photoshop, and well, this will look at the suppose of the talk about some rhythm. It will look very clear. You will get well, ST elevation is there. In atrial fibrillation, they will show that this is this. But when you go to clinical scenario, look at this picture, this cartoon, and when you look ECG in the books, it look like this. But when you go to clinical scenario, things become entirely different. There could be a artifact. There could be a different kind of finding which are not given in books. And in books, everything is not. So that's why ECG comes with experience. And this program I'm sharing with, I share my experience with people and make them understand with clinical ECG, not theoretical. I'm not selling you any video lecture. No, I have tutorials, but that I will say that if you go for only tutorial, that will not help you in real clinical scenario. But during our program, how we conduct this program, let me tell you. We have a website where I have recorded tutorial. Okay, if you join today, some of the members have joined today. Already joined the program and started reading the lectures. Okay, once you complete the theory, then main parts comes the practice session. So that we conduct on. There is a mention. Not audible? Am I not audible? Niranjana Patil.
Audible, sir. Audible.
Audible. तो वैसे मुझे confuse ना करो ना, बीच में फिर rhythm टूट जाता है मेरा. So we have a website. As soon as you join our program, we will give you access to our website. Okay. Number 2, you will have a flexibility of timing. Whenever you want to read, you can open that particular video tutorial. You can read that particular thing, and we have a WhatsApp group. Immediately, if you have any doubt, you can ask there. Like I have shared some screenshots. Some member was asking about something. RAD कब होता है, right axis deviation कब होता है. तो मतलब people who join earlier, they learn more than the people who wait for the last day. Last day में क्या होगा? I will give you tutorials, or next day I will go ask you. Today I am going to conduct the session on a particular topic. So immediately your topic is not prepared, and also you will be not be able to make the exact diagnosis. So that's the problem. That's a big problem. So it is highly advisable. Just a minute. Just a minute. join our program in a earlier, complete some lecture. Even बहुत से members ने पहले से join करके खत्म भी कर दिए chapter. इतने dedicated students they are asking. So what happen if you learn in advanced theory part? Although then we will be conducting a practice session on WhatsApp. Why WhatsApp? Because on Zoom it's not possible. On WhatsApp, I can mark, I can tell you where you are wrong. So this ECG is like a physics numerical until unless you practice it on your own, and that too in the presence of a tutor expert, you cannot learn ECG. That's why we have a very good results. Okay, and about ECG and good feedbacks. And so weekly we conduct a Zoom session, revision Zoom session. We take on the weekend, we take the doubts of the members. Okay, so that was about our program. So all about that. And you all know what is the fee structure. Duration is 30 to 40 days. Even after that, you will get lifelong access to practice sessions and video tutorials also. Okay, so it's not like a program ki, like other program. They will make a good rapper and attract you and will ask you, okay, just purchase. After that, you will not be able to interact with the tutor. But here, many students are maybe join old student. I can see some old student. So they know I'm always I'm a cooperative person with my students. If there are a lot of members are there who even join for revision also after 2 or 3 years. So because we keep upgrading various programs. So let us start with the ECG, our main topic. Okay, today's topic. So as I promised that we will start from the very basics. So very basics means ECG paper. What is ECG paper? This is the vertical coordinate. This is the horizontal coordinate. Everybody know. You know about the coordinate mathematics, and this is the basic thing. Okay. So next things come. Very small square of ECG paper. So what is the value of a small square in a vertical and horizontal? Here it's mentioned. On horizontal coordinate, we measure the intervals. That is in the unit of time, seconds or millisecond. And in the vertical coordinate, we measure the heights and depth of the various waves. Okay. And the value in the horizontal coordinate, the value of the one small square is 0.04 second. And in the vertical coordinate, the value of one small square is equal to 1 millimeter. Just remember this. Then you will be able to calculate the height and depth of the various waves. Like suppose this is small square, this is big square. Okay. क्योंकि कुछ लोगों को बहुत ही beginning से बताना पड़ता है, तो मैं इसको भी बता के चलता हूँ. So as I told you that if there is a suppose we have to calculate PR interval. Okay, PR interval start from just from the beginning of the P wave to the R wave. Okay, so what we have to do? We have to just calculate the number of small square. You can see here 1, 2, 3, 4. How much there? 5. 1, 2, 3, 4. There are 1, 2, 3, 4 small square between beginning of P wave and R wave. So this is the PR interval. It's very important. PR interval. Okay. So 4 intervals. So just multiply one small square is equal to 0.04 seconds. So 4 small square will be you can just multiply with it would be around 0.16 second. So these are the basic, very basic thing most of the doctors know. But our program is very large program. So I have to describe lot of things in a very fast speed. तो हो सकता है बहुत से मेंबर को ये लगे कि नहीं समझ नहीं आया, एकदम स्लाइड बदल लिया या फिर मैं इधर था आप उधर थी, ठीक है ना. बट हियर यू कैन सी. सो ट्राई यू कैन अंडरस्टैंड कि जब when the program will start, then how deep will go, कितनी डीप जाके हम एक चीज को पढ़ाएंगे. यही चीज आपको पीआर इंटरवल प्रैक्टिस सेशन में भी दी जाएगी. कैलकुलेट करो इसको बिल्कुल एग्जैक्ट स्मॉल स्क्वायर में, क्योंकि यू नो थोड़ा बड़ा हो गया तो आपका प्रोलॉन्ग हो जाएगा. और WPW सिंड्रोम में शॉर्ट भी हो जाता है, तो शॉर्ट इंटरवल भी आप कैलकुलेट करना बड़ा मुश्किल हो जाता है। मैंने देखा, मैंने ड्यूरिंग प्रैक्टिस सेशन लॉट ऑफ पीपल, उनको बोलो कि जस्ट कैलकुलेट, तो वो बताते हैं इट्स 3 स्मॉल स्क्वायर, तो नॉर्मल तो 3 से 5 हुआ ना। तो यहाँ पे फर्क आ जाता है कि बिल्कुल एक्यूरेसी से चलना है विद ईगल आई, दिस इज द फंडा। And the ECG is just a dance of various waves. First, you have to understand what are the various waves. P wave क्यों बनती है, फिर Q wave क्यों बनती है? Can anybody tell? Let me ask you people also कि आप लोगों को कितना पता है, ठीक है? Okay, so P wave is due to nobody know. अरे you can type यार. Yes, atrial depolarization. Atrial contraction लिख रहा है कोई?
Sir, atrial depolarization.
Acha. Okay. So there are some idiot doctors who are online teaching that the P wave are due to formation of contraction of atria. There are so much idiot doctors and उनकी प्रमोशन इस साइड पे चल रही है कि बच्चे बच्चे के मुंह पे उनका नाम है, उनका वीडियो देख लेना जाके, ठीक है? ओके, डिपोलराइजेशन, बिकॉज ECG is an electrical activity. We measure electrical activity, not mechanical activity, or not it's electrocardiography, not myocardiography. Okay, there are the condition like PEA, pulseless electric activity seen in cardiac tamponade, where you can see there is a no contraction of atria and ventricle, and there is strangulation due to cardiac tamponade, collection of blood in the pericardium. So still you can see P wave. So how can you say? So some idiots still saying online, because after Corona, every Tom, Dick and Harry pretend to be a teacher. They record some video and keep on selling and making fool of the doctors. So this profession में कभी आप किसी को fool बना के ना चले, life saving profession, especially ECG. Okay. So what is significance of PR interval? Can anybody tell? ये बैक नॉइज ना है प्लीज.
Interval between the atrial depolarization and the before the starting of ventricular depolarization.
What is the significance of PR interval, Dr. Abdul? Important significance क्या हुई? क्यों रखा है हमने PR interval? भगवान ने बना के.
How much time?
Oh, yes, yes. Hindi, you can speak in Hindi also, यार. क्या हो गया?
Take from atrium. It shows the conduction speed from SA node to AB node.
Yes,
I think
you are close. Let me tell you, it give time for ventricle filling, because blood flow from atria to ventricle, na, so it provides some time. 1 second delay to full ventricle. Okay. Shakiba Hussain, oh, very good, from Afghanistan. How are you, Dr. Shakiba? Dr. Madhumita is there. These are my old CT scan program. Dr. Madhumita, Madam, Dr. Shakiba Hussain, I think she is from UK. Doctor, yes. So old member are there, also there. So yes. So this was about the basic. So let us move further. क्योंकि यहाँ पे बहुत से लोग ऐसे भी हैं जिनको बहुत बेसिक पता है, बेसिक भी नहीं पता, तो उनके लिए ओवरहेड ट्रांसमिशन हो सकता है. बट इट्स माय, अगर मैं सिर्फ आपको आज PR इंटरवल ही पढ़ाऊंगा तो काम नहीं चलेगा. मैं ये पूरा सेशन खत्म होने में आई हैव टू टीच यू VT, पॉलीमॉर्फिक, देयर क्या उसमें क्या क्या होता है, बहुत कुछ है. तो फॉर द मेंबर हु हैव ऑलरेडी जॉइन्ड आवर प्रोग्राम स्टार्ट तो नहीं हुआ है, बट ये है कि महेश, यस डॉक्टर महेश, मैं आपकी चैट देख रहा हूं. आई एम वाचिंग द चैट, डोंट वरी, you can keep typing. Okay, so this is how we calculate the interval. So 1 small square is equal to 0.04 seconds. So multiply T number of hours. So suppose you have to calculate QT interval. So from Q to end of the T wave, okay, you can calculate the number of how much number of T small square are there, तो multiply कर दो. वैसे QT के लिए हम QTC यूज करते हैं करेक्शन, क्योंकि बिकॉज QT वेरिएट विद द हार्ट रेट, so that's why we have to do correction using Bazet formula, but that is a different thing which we will cover in the program, not right now. It is just for giving idea. So I have given you an idea about interval. Now let us learn how to calculate the height of the various wave. Okay, so simply, as I told you, that one small square is equal to, in the horizontal curve was, it is a 0.04 because it was the dimension of time. SI unit is a second. Okay, but in a horizontal vertical coordinate, we have to measure the height. So height is a dimension length. So we have to use the one small square millimeter, because it's a ECG ना, किलोमीटर में तो मेजर नहीं कर सकते, तो we have chosen millimeter में हम choose करते हैं. तो one small square is equal to 1 millimeter. So if we have to measure the height of the R wave, so we will measure from the base isoelectric line. This is isoelectric line. How much number of small square are there, as I mark here. Okay, so 1 2 3 4 5 6 7 8 9 10, तो 10 हो गया, तो 10 multiply by 10, 1 simple 10 millimeter height होगी. This is important in when tall T waves are there. Okay, वहां पे important हो जाती है ये चीजें, तो you should know. Okay, so these are the basic thing. तो अभी मैं इसको बहुत short में describe कर रहा हूँ. So now let me tell what should be the first thing one should look in the ECG.
The calibration, sir.
Pardon, who is saying? Yes, please. Yes, Abhijit Rana. What is the first thing one should notice in the ECG?
Rhythm, sir.
Calibration.
Rhythm.
Elevation. डॉक्टर जोशी बोल रही है एलिवेशन.
Rhythm, sir.
Calibration. QRS interval.
Very first thing before holding
Calibration.
Calibration.
Just at the first we see the calibration. After that we can
Exactly.
see it is regular or.
Exactly, Dr. Shakiba Hussaini, you have nailed the thing. First thing is check the calibration. That's why मैंने आप सब लोगों को जब पहली बार आपको हार्ट रेट कैलकुलेट करने को बोला तो सबने गलती कर दी, ब्रेडिकार्डिया बोल दिया, बिकॉज कैलिब्रेशन किसी ने चेक नहीं की थी. नाउ व्हाट इज कैलिब्रेशन? Calibration is nothing, but it is the technical setting of the machine. If you can see here, should I zoom it? Look here, calibration. So जब भी आप ECG देखेंगे तो you will find two factors. This is the 25 millimeter per second, means the rotating speed of the ECG paper. This is a standard, and this is the voltage applied, 10 millivolt. अगर हम यहाँ पे 25 की जगह स्पीड को 50 कर देंगे तो हार्ट रेट will become half, because ECG paper will start rotating at double speed. So the पेन जो टैप करता है ECG पे मार्क करता है वो लार्जेस्ट स्पेस पे टैप करेगा, तो वो जो आपका आरआर इंटरवल वो बढ़ जाएगा, तो अपरेंटली लुकेगा पेशेंट को ब्रेडिकार्डिया है, बट इट्स नॉर्मल. तो अगर इसको मैं 50 कर दूंगा तो यहाँ ब्रेडिकार्डिया बन जाएगा. ठीक है. सिमिलरली अगर इसको 25 की जगह मैं इसका हाफ कर दूंगा तो ये बहुत टैकीकार्डिया हो जाएगा, इसका भी हाफ हो जाएगा जो भी इसका हार्ट रेट है. दैट्स इंपॉर्टेंट. दूसरी चीज, लुक एट द वोल्टेज. दिस इज द 10 मिली वोल्ट. इफ यू ऑडिबल थोड़ा सा जूम कर लेना, मोबाइल पे ऐसे करोगे तो हो जाता है इजीली. So this is, you can see here, 10 millivolt, 10 mm per millivolt. So this is the voltage applied. So if it is 20, so jo height, then the height of and depth of the various waves will become double. 20 होगा तो, और 5 हो गया तो भी गड़बड़ हो जाएगी. तो first thing you should look, क्योंकि पेरिफेरी से कई बार ऐसे लोग आते हैं, वहां पे कोई कंपाउंडर है, वार्ड बॉय है, उसको पता नहीं, हाथ लगा दिया, सुपर स्वीपर ने हाथ लगा दिया, थोड़ी सेटिंग चेंज हो गई उसकी, और वो डॉक्टर ने मेजर करी, डॉक्टर को खुद नहीं पता था कैलिब्रेशन भी कोई चीज होती है, एंड कर दिया ब्लंडर, एंड पेशेंट को आया, वो उसको लगा दिया एट्रोपिन, बोल रहे हैं कि इंसर्शन कर दिया कार्डियक. मैंने ऐसा देखा है, बहुत सारे ग्रुप में पोस्ट की हैं ये वाली चीजें. कोई कहता है इसको एट्रोपिन दो, इसको कहता है इसको वो दो, कोई ये दो। अरे बेवकूफ हो, अगर उसको कार पेस चलते फिरते आदमी को पेस मेकर लगाओ, कितनी बड़ा ब्लंडर है। तो यू शुड नो दिस। अगर आपको कैलिब्रेशन ही नहीं पता तो ECG तो नहीं पता कम से कम। एंड सेकंड थिंग, और भी बहुत सी चीजें हैं, you should note all the leads are there marked. What happens sometimes some lead could be missing. Now they are advanced level of machine. If there's a lead get detached, so they will not give the tracing. But ऐसा नहीं है कि सब उतनी advanced सब जगह पे हो. Still we have in periphery, we have a single channel machine जिसमें interpretation में नहीं आती ECG machine की. तो हमें ये चेक करनी है कि all leads are properly marked हैं. कोई आपका ये and rhythm lead. What is the rhythm lead and what is its significance? Can anybody tell? You can unmute yourself or chat में कर सकते हैं. What is the significance of rhythm lead? Rhythm lead is nothing. It is a long lead traced at the bottom of the every ECG. So this is the rhythm lead. So what is significance of rhythm lead? जब यहाँ है हमारे पास lead 2, तो इतनी लंबी lead क्यों ले रहे हैं हम लोग? बताइए डॉक्टर्स।
So it's mainly to measure the heart rate, and also especially in case of atrial fibrillation where there's an irregular heart rate.
Please mention your name, please.
So it's me, Mahesh, Dr. Mahesh.
Very good, Mahesh. Yes, please continue.
So it's basically to measure the heart rate, and if it's a sinus rhythm, it's not much problematic to measure the heart rate in the other leads. But if it's irregular, then it becomes difficult. So we take a rhythm strip to measure the heart rate, especially if it's irregular.
Thumbs up for Dr. Mahesh, because this is the most important thing. Rhythm lead itself means rhythm. Whether you have to calculate heart rate, you have to check whether the rhythm is regular or irregular, because the method of the calculation, the both are the different. Irregular में different method रहेगा, एक तो ये reason हो गया. Another thing, there are some cases like blocks, okay ना, AV blocks. कुछ टाइम के बाद एक ड्रॉप आ रहा है, तो वहां पे हमें एक लंबी लीड चाहिए जिससे हम कैलकुलेट कर सके. ठीक है, तो रिदम को चेक करने के लिए कि व्हाट इज द रिदम. व्हेन आई से ना रिदम, तो इनिशियली वी टॉक अबाउट रेगुलर है या इरेगुलर है, बट व्हेन वी ग्रो अप इन ECG, when we use the word rhythm, you should say whether it is atrial fibrillation, flutter, or what is the rhythm. So in this way, okay. So Chandration, Dr. all of you, right? मैं पढ़ रहा हूँ आप सबके कमेंट्स, और सबके मैं वो नहीं दे सकता. I can't reply individual to everybody, so but I am reading every comment. So this is the importance of calibration. आज आप यहाँ से चाहे जाओ, कम से कम एक बहुत इंपॉर्टेंट चीज सीख के जाओगे कि होल्ड करने से पहले ये देख लेना कि उसकी सेटिंग क्या है. कैलिब्रेशन ECG को देखने से पहले सेटिंग्स जरूर देख लेना. कई बार गड़बड़ हो जाती है तो बहुत मुश्किल हो जाती है, और इवन हाथ लगने की देरी होती है, सेटिंग चेंज हो जाती है. ठीक है डॉक्टर शकीबा, यस, ओके, I will take care of that. But sometime I have to, since I know you are from UK, so you cannot understand Hindi. But sometime most of the people, 99% people are Indian, so they can understand Hindi. So ऐसा कुछ नहीं, I will repeat. कुछ मेरे मुंह से हिंदी में निकलता है तो I will repeat in English also. Okay. So now, so let us now learn how to calculate the heart rate. So before calculating calculating heart rate, you must know one thing, whether the rhythm is regular or irregular, because the method of calculation is different in both. So how do we will calculate that the heart rate is regular or irregular? Just look at this. Let me rub something. Give me a time. I think there is a eraser. So if you see a calculate number of square 4, 4, 4, so easily even by single आपकी अगर simply by a good vision you can analyze whether the rhythm is regular or irregular. If RR wave are placed at equal distance, then the rhythm will be regular. If they are placed at the different distance, then the rhythm will be irregular. Okay, so if the rhythm is regular, then it's very easy. There is a simple formula derived by physics equation, not by a doctor's physics equation according to calculation of rotating speed and all that. So here what you have to do, you have to just calculate the number of big square between two RR waves and just divide it by divide 300 by 4. Now you may be thinking from where this 300 appeared. So this is a constant figure derived from a physics equations. Like physics में आप पढ़ते थे ना G for gravity, तो कितनी वैल्यू उसकी 9.83 क्यों होती है, अरे वो derived करके होती है. तो इसी तरह से something are derived. Okay, so अगर आपको if there is a heart rate is a if the rhythm is regular, just divide 300 by the number of the big square between two RR waves like this. So you can see here 1, 2, 3, 4. Okay, so if we divide 300 by 4, so it is very easy. It is 75 beats per minute. So very easy. But problem comes when there is a irregular rhythm. So here we need a long lead, because we have to do, we have to choose 30 squares. Okay, so for 30 squares, you can choose from anywhere. Okay, you have to choose 30 square. Just I have started counting from here 1, 2, 3, 4, 5, 6, 7, blah 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 30, and now I have counted what number of R will appear in between 30 big squares. So there are 9. So just multiply 9 by the factor of 10. Now again you will ask that from where this figure of 10 will 10 appear. So this is again a physics derivation, constant derivative. जिसके साथ we have to multiply we have to multiply with the number of R wave. Suppose there are 5 waves between 230, so we can multiply by 5 by 10, so that will be 15. And here we can see 9. Then so these are slides available on website, and each and everything is available. And most of the people who have already joined, for them this is a child play. Okay, so let's come axis deviations. So usually this method, this is for guesstimating. Okay, so you cannot tell the axis in the degree. It is just for guesstimating. If the when we teach the program, we will give you video and demonstrate how to calculate the axis in the degree. Here you can see most of the people left axis, right axis. If you ask them the value of what is the normal axis, they will not be able to tell you, because वही है ना superficial book से पढ़ा बस. So you can, I am telling you just for guesstimating, because that is the long topic and I cannot discuss right now. So just check lead 1 and 2 and just check the peaks, whether they are reaching or leaving each other. Leaving each other, L for leaving, L for LAD, left axis deviation. Just remember this formula for guesstimating. Another thing is, if the peaks of lead 1 and 2 are reaching, they are reaching each other. Reach, R for reaching, R for right axis deviation. Just for guesstimating, you can have an idea about this. Now, next thing, very important from today, you have to learn from this program. Can anybody tell me the 4 rhythms declared by AHA, American Health Association, 4 rhythms of cardiac arrest? So let me see who defined the cardiac arrest specifically. Please, either chat down or mute and say, how will you define a cardiac arrest? Give me a standard definition. ये नहीं कि patient को heart बंद हो गया, ये हो गया, वो no. 3 word standard definition. according to HA guideline. Anybody know? Nobody know? There are so many doctors, and it's a very important thing. Oh, just okay, chalo cardiac arrest अब बता दो. What is cardiac arrest?
Sir, when a heart stop beating is called cardiac arrest. And cardiac muscle is
That is syncope. Yes, Yoshi.
Maybe I said the main cardiac arrest is when the first one is when ventricular tachycardia, ventricular fibrillation and asystole, and also maybe no, it's not. Pass this.
No, you are this time you are not very accurate. You are close. Anybody else?
Stoppage of both mechanical and electrical activity of the heart.
Because electrical activity can be seen in pulseless electrical activity. That is a one cardiac arrest. When there is a cardiac tamponade, then how can you say electrical activity? Mechanical activity, okay, I can understand. But there are conditions.
Also, the clinic is sir, the clinic maybe show maybe not 100% show sudden collapse, no pulse, no breathing.
Yes, somewhat close. Are only females are speaking in the Zoom session? Here are the males.
Temporary cessation of heartbeat, sir.
Temporary cessation of heart is syncope.
Okay.
It is cardiac arrest. It is permanent sedation. Patient मर जाएगा जी cardiac arrest में मैडम. CPR नहीं किया तो. Let me tell you 3 standard definition. लिख लीजिए. Unconscious, non-breathing, pulseless patient. 3 words standard AHA definition. कहीं भी जाते हो इंटरव्यू में वाइवा में पूछते हैं 3 standard definition of cardiac arrest is not like this. दूध बंद हो जाएगा. Patient is unconsciousness. You will shake. He is not conscious. Non-breathing. There is no breathing. There is no pulse. 3-word definition of cardiac arrest standard. Remember this or write it down. Okay. वाइवा में काम आएगा. Now, next question is, tell me the 4 rhythms selected by the American Health Association that should be that are considered in a cardiac arrest.
Asystole, pulseless electrical activity.
Yes, Dr. Bindu, but you are not so loud. Yes, please.
VT, VF, asystole, pulseless
TVF.
electrical activity.
Yes, excellent.
Pulseless electrical activity.
Yes, excellent, Dr. Bindu. Excellent. Look, VT means ventricular tachycardia, ventricular fibrillation, or VFib. Asystole means flatline, you know, and pulseless electric activity. These 4 rhythms are considered under cardiac arrest by WHO and AHA, and also ICMR and all your American College and all. This is the standard 4 rhythm. If you don't know anything, you must know these 4 rhythms. These are the life-saving rhythm. अगर ये नहीं पकड़ा तो फिर कुछ नहीं हुआ. You are not a doctor, okay? Because patient is serious, कोई आ गया बेहोश है, cardiac arrest में चला गया. If you don't know how to manage, what to do, how to resuscitate, you will resuscitate ना. Even if you know कि patient को cardiac arrest है. If you don't know cardiac arrest में आप पानी डालोगे, छिट्टा मारोगे. But in the Western countries, you can see even at school level they teach BLS, basic life support सिखाते हैं. आप movies वहाँ की web series देखते होंगे. Somebody got faint immediately, chest compression, mouth to mouth दिया जा रहा है. ठीक है ना? हाँ, they are school level पे. Even जो defib are available at the airport, public places. इंडिया में तो पंखा नहीं छोड़ेंगे रेलवे स्टेशन में, वहां पे डिफिब भी लगा के रखे होते हैं. So let me tell you what is. Let us start ventricular tachycardia. So most of you might have seen the ECG of the ventricular tachycardia. Today look at the video of ventricular tachycardia. I think on my screen it is okay, but when it is streaming, it is little bit slow. So as you can see, look, there is very fast contraction of these ventricles. What's happening? If there is very fast contraction, there will be no time for filling of the ventricle, and there will be no cardiac output. So patient will go in a cardiac arrest. So there could be two type of cardiac arrest clinically: pulseless VT and VT with pulse. Sometimes patient can come with VT, but there could be a feeble pulse. Okay, but in pulse, we are talking with VT in cardiac arrest, where they pulseless VT. Pulseless VT को बोल रहे हैं cardiac arrest यहाँ पे हम, ठीक है? So how it's happened? Just you can read this in VT some foci. Actually, what happened in VT? Let me tell you in simple language. This is something like what happened. Usually, you know, the SA node is the pacemaker. Okay, normal rhythm comes from SA node and enter the AV node that enter interventricular interventricle, and then left and right bundle, or everything, you know, the conduction system. Okay, suppose what happened, some foci, what are foci? Foci is just like SA node, just irritable foci, some part of the heart muscle develop inside the ventricle and start firing at very high rate, and it is pressing the sinus node, sinus rhythm, and producing a very fast contraction. Then what will happen?
Effective filling.
Cardiac arrest. So this is the pathophysiology. You should understand this. I can give you an example. Suppose there is a country, India. Okay, we have a parliament in India. We have a capital in Delhi. We have a parliament. Okay, this is a sinus rhythm. सब कुछ rule बन के वहाँ से आ रहे हैं सब. Suppose somewhere else in the state में कोई some powerful organization develop हो जाती है, वो अपना अलग से ही चलाना शुरू कर देते. So this is like that. It is not following the normal sinus rhythm. Ventricle is generating some part foci, irritable foci are generating its own impulse and very fast. So the new leader doesn't know how to run the country. So the new rhythm is firing at the andhadhun rate. So what will happen? There will be very fast contraction of the ventricle, and it will not get time to get fill up, and there will be no cardiac output or very less cardiac output, and patient will go in cardiac arrest. Okay. So now let us talk about ECG feature. Okay. So now here you can see, here is some foci, it's firing. Okay, this is a normal normal sinus rhythm, and this is for comparison. This is the VT. So what is happening here? You can look. These are the bizarre complex. Actually, in this figure, it is not very well. Here you can see it. So you will find this kind of typical picture in the VT. You will find, you cannot say, people say they're broad QR. These are not actually QRS complex. They are the weird shape complexes, and but regular. And heart rate is more than always more than 170 at least. Okay. So these are firing. So you will get this picture. Okay. And on cardiac monitor, it will start showing beep, patient VT mein gaya. Okay, immediately what will do? How will you manage this patient? Patient ja raha hai. Tell me. Arey, tell me, yaar.
Defibrillation.
Doctor, SBT and VT में जमीन आसमान का फर्क है. Supraventricular tachycardia.
Sir.
SBT, what you want to ask, Ashwini, Dr. Ashwini? VT means SBT, na? No. SBT means supraventricular tachycardia, the group of the tachycardia that have origin above than the ventricle that are supraventricular tachycardia. There are a lot of rhythm, AVRT, AVNRT, atrial tachycardia, MAT, atrial fibrillation, fast AF, a lot of rhythm here. But in VT, the foci is below in the ventricle. That is supraventricle. This is ventricular tachycardia, not this. Okay, yeah. So Dr. Himalaya ji, okay, 122 जूल बोल देंगे हम. Yes, very good. We have to imitate cardioversion करना है इसका और कुछ नहीं करना है हमने, ठीक है ना. इसको कार्डियोवर्ट कर रहा है. And apart from that, we have to give a good chest compression. CPR नहीं देना है, वो भी देना है. Okay, can anybody? How many of you have given CPR? Lot of people might have given. Okay, let me ask you a practical question. Suppose there is a patient in front of you and you are giving CPR. Okay, so how will you judge that the patient who is giving chest compression is enough to supply blood to the vital organs? How will you access? Don't tell me bookish thing कि 10 सेंटीमीटर अंदर जा रहे हैं, वहां स्केल लेके तो आप खड़े नहीं होंगे. Just tell me practically, जो लोग क्लिनिक्स में रोज करते हैं ना, हम वही बता सकते हैं. I don't ask bookish thing. Just simple language में patient breathing. No. Just let me explain. Stella is also there from US. So I think she was okay. No, Dr. Mahesh, what? Yes. Dr. MD Ajad. Yes. So let me tell you, if somebody is compressing the chest, simple logic is there. Why we giving chest compression? Just to ensure that the till the ventricle get revert back into sinus rhythm, the white blood is we are pumping the blood manually to the vital organs. So how will we can palpate the pulse? Simple. The third person who is standing away in the front can palpate the femoral pulse. If his chest compression and giving a good femoral pulse, then he is giving good chest compression. ऐसा नहीं है कि वो पसीना पसीना हो रहा है, उछल रहा है, मगर चेस्ट पे कोई जोर ही नहीं पड़ रहा उसका. He is not at the right place and right type of compression नहीं दे रहा है वो, तो it's a useless. So you can palpate the pulse, check and tell the doctor change कर लीजिए, आप थक गए हैं, दूसरे को आने दो. Okay, so this is the method, practical method to give the chest compression, to check the chest compression. Yes, carotid, check the carotid. But what happened at that time, one person is giving ambu bag and other लगे होते हैं वो intubate करने में, तो थोड़ा मुश्किल हो जाता है carotid. तो that's why femoral दूर खड़े हैं, आप observe कर सकते हैं. Okay.
Hello.
Yes.
So can a normal return of a normal rhythm can be taken as a positive CPR?
Return of the.
If a rhythm becomes normal while doing a CPR, can we take it as a positive sign?
That is the revert back हमने कर लिया नहीं, but we got success. I am telling about chest compression कितना दे रहे हैं. Once the patient get revert, उसके बाद तो या तो पेशेंट ऊपर गया या फिर एनालाइज किया, जिन ठीक हो गया तो अच्छा था, बाद में थोड़ी ना एनालाइज करोगे. एट द टाइम में बात कर रहा था. ठीक है, आपकी बात भी कि रिवर्ट बैक हो गया, नॉर्मल रिदम आ गया, बट आपके कंप्रेशन से कभी नॉर्मल रिदम नहीं आएगा, आर्टिफैक्ट्स ही आएंगे. ठीक है, ये चीज ध्यान रखना. तो फीचर्स ऑफ बीडी, कैरेक्टरिस्टिक फीचर आपने यू हैव मस्ट राइट हैव सीन the broad complexes, regular tachycardia. ध्यान रखना, regular tachycardia, broad complex separated by equal distance. Here you can see the PQRS waves are fused. You cannot appreciate individual. This is P, that is Q or RS. No, not like it. Without pulse, it's a PEA. It's normal. Yes, without pulse. No, बात नहीं बनी. So okay. So let us discuss about little bit sustained and non-sustained ventricular tachycardia. Let me I think screen is not sustain and non-sustain. So sustain and non-sustain. So by the definition in every book you can see, you can read here from a in non-sustained ventricular tachycardia, it is defined as the more than 3 beats of ventricular region, blah blah blah, lasts for 30 seconds and the duration that ever revert back. Okay, this is the blah 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 theoretical thing. Let me show you the practical thing. Okay. What is the non-sustained VT? Non-sustained means it is non-sustainable. Okay. So look at here. What is happening? Look at the complete rhythm, then tell me. You will understand better. Tell me your observation. I'm not asking. Tell your observation. क्या देखा आपने इसमें? What you have noticed here? Let me play again.
ventricular tachycardia.
Can anybody tell me?
Normal rhythm changing over to ventricular tachycardia. Then
Yes.
again
Tell
it
your
reverts
name.
to normal.
Please tell your name.
Bindu. Dr.
Very
Bindu.
good. Excellent, Dr. Bindu. आप बहुत अच्छा आंसर दे रही हैं. I am highly impressed. Okay. So what is happening? Let me play again. This is normal sinus rhythm. Okay. And suddenly 4, 1, 2, 3, 4 appeared. That broad ventricular tachycardia wali beats, broad complex appear, and then again rhythm revert back to the normal sinus rhythm. So we will call it as non-sustained VT. VT sustain नहीं रहा, थोड़ा सा आया चला गया, ठीक है, कुछ नहीं हुआ, no problem हुई. But this is alarming sign because same patient का I will going to show you next कि ऐसा अगर if this happen, suppose you are in CCU watching the ECG, एक central monitor होता है ना CCU में, सबको पता होगा, तो we are watching the normal rhythm के बीच में किसी के 4 beats आ गई या 5 beats आ गई या 30 seconds के लिए, whatever that this definitions है, bookish definitions है, 3 beats आ गई, 4 beat आ गई, 30 second के लिए आ गई, ये bookish में मैं आपको दे दूंगा, वो आप पढ़ते रहना. Right now we will talk about practical things. So if you notice, you become alert that this patient is going to be into the VT. Before it's go into the VT, prevent it. Be ready with a defib. Look. Now, look. The same patient. Previously, it was non-sustained. Now it is sustained. So normal sinus rhythm is getting converted into sustained VT. So previously, there was normal sinus rhythm followed by a VT, sustained VT, now VT. There is no, not reverting back. Now you have to give the shock. You have to resuscitate the patient immediately, otherwise he is going to be crash. Okay, very easy. So other variants of VT are polymorphic VT and monomorphic and polymorphic. Actually, clinically and at the when we are going to manage, there is no rule, but these things are given in the books. That's why we have to teach this. What happens in usually the VT is monomorphic. Okay, there is only one foci that is firing, but sometimes what happens more than one foci start firing. But so we will get little bit VT and little bit different morphology of wave. So VT can also be classified. Let me read this for you people. Monomorphic VT, most common type. In polymorphic, there will be more than 2 foci. 2 foci means I will explain you. Note it. So look at here. So we can notice here that this is the VT, okay? But some waves are different. So that means now some other foci is also firing. First I have told you that VT में some foci have started firing and there is a VT. Now apart from one foci in the ventricle, one another more than 2 started firing. So it becomes polymorphic VT. And the most common form, most malignant form of a polymorphic BT that I want to show you is TDP, Torsades de Pointes. Okay, so here you will see twisting of spikes. You will see this kind of typical party ribbon shape, twisting of spikes. So you have to be very careful. Usually it is self-reverting. If I show you TDP like this, so you can see if you make, so it will look like a party ribbon shape. Still, I would like to show you how it actually look in a cardiac monitor, the real scenario. Books में तो कुछ भी दिखा देते हैं. But when you have to face, let me show you the video. Yes. So now, okay, look here. Look. So here the axis is changing after a few bit by 180 degree. Okay, that is the definition. So here look, these group of weird complexes are facing in opposite direction. So here, if you draw, it will make a party ribbon shape. So in clinical scenario, you will this Torsades de Pointes will look like this. So this needs lot of practice. That's why ECG can learn only and only with practice. Although I give my lectures, video, my slides, I have prepared a lot of things. But apart from that, I focus on the practice, and that too on the clips, mixed clip, and different real clips, real clinical clip. So that is the significance of our program. Okay, so let us talk about the ventricular fibrillation. What's happening here? Look. Here you might be thinking that heart is contracting, but heart is not contracting, rather it's quivering. Can you understand the difference between contracting and quivering? It's just quivering. It's quivering, so that means there is no contraction, no cardiac output. So why it's happening? Because, let me show you one more animated video if I have. You can see multiple now. Previously in VT, I have told you one foci was firing and was producing a broad complexes, and but maybe in polymorphic 2 or like that. But in VFib, several foci started firing. Okay. Now you look at this figure, look at these foci, various this pattern. This. So various foci are firing. Now there is no net depolarization of ventricle and no contraction. So what we will find on ECG? Nothing, just fibrillatory waves and nothing else. Okay. So these are the 4 important rhythms. And on ECG, you can see it can look like this. So irregular, ill-defined fibrillatory waves, nothing else. Patient in cardiac arrest. Very 4 rhythm I taught you, very easy to recognize. Okay. So last, this one is asystole, flat line. इसको तो कंपाउंडर भी बता देगा ना. Even compounder can tell. Am I got disconnected?
No, sir.
And why not members are not appearing to me? Okay. So next is pulseless electrical activity. Let me explain you with an example. Here you can see there is some, suppose there is some injury, chest injury, and blood start accumulating inside the pericardial cavity, and it start immediately collection of blood. Due to immediately collection of blood, there is a high pressure inside the pericardial cavity that strangulates the heart. heart is not able to relax and not able to pump and relax. So what will happen? There will be a ventricle will become just like suspended. Okay. So in this case, we will see the electrical activity, like it could be a normal sinus rhythm, tachycardia or bradycardia, but normal. In that case, you should be careful that there could be two reasons. One is tension pneumothorax, that is compressing the heart to a non-contractile state, or it could be a cardiac tamponade, collection of blood inside the pericardium. So we have to immediately decompress into both conditions. In the pneumothorax, it's very easy, but in the cardiac tamponade, only specialists can decompress this. So next thing, next rhythm, let us discuss about is, let me show you this clip letter. Who will tell this? Let us see what is going over here. Look, my dear friends, this is the heart. These are two chambers. Okay. So you can see around the heart, there is a hypoechoic shadow. Hypoechoic shadow. So this is a massive pericardial effusion. So what is happening in massive pericardial effusion? Heart is suspended inside a pericardial sac, and there is a lot of fluid. So it will move to and fro. It is moving to and fro, if you see. Heart is contracting and relaxing, not strangulated like cardiac tamponade. This is a different rhythm. This is a pericardial effusion. Okay. So heart is suspended inside a pericardium. उसके अंदर वो contract भी कर रहा है और फिर suspended तो move भी कर रहा है. So why I am showing you this clip? Because this is a very interesting rhythm. Okay. What interesting rhythm? Let me tell you. So when the heart will move like this, when it comes closer to the chest wall, then it will generate high voltage impulses, and as it will go far away, it will generate lower impulses, these complexes. So we will get a electrical alternance. This is a specific and rhythm seen in massive pericardial effusion. Here you can see alternatively lower and short voltage QRS. You can see easily, very easily. अगर आपको कहीं भी इस तरह का देखने को मिलता है तो think about pericardial effusion. Just a minute. So we will observe. Now let us come to next. So during I think some doctor was asking program video को देखने के बाद कि about atrial fibrillation. So let me tell you what happened in atrial fibrillation. Now first look at this video carefully. Now let me explain you what is happening. Now previously there was only one SA node was firing and it was conducting the impulse. मेरे पहले वीडियो में in the website पे मैंने जो दिया है उसमें normal है, तो normal rhythm. But here what happening? lot of foci develop on the atria, and they start depolarizing in a asynchronous manner. Either in different direction may they are starting depolarizing. So what will happen? There will be no net depolarization of atria. There will be no contraction of atria, but some impulse will still can pass through the as AV node. But when they pass, they will produce a normal QRS. So here two things we will notice in the ECG. Since P wave represents depolarization of atria, there is no proper depolarization, so there will be no P wave. Second thing, some impulse are reaching the ventricles to produce a QRS complex. So we will find a irregular rhythm because यहाँ पे irregular manner में ही जा रहे थे ये. So here you can see, so two main finding of AFib bar. So if you read the conceptually, there will be no problem in ECG. But if you do a rectification, तो फिर मुश्किल है. So if you can see, rhythm is irregular, there is no P wave. Simple, this is atrial fibrillation. So we teach with a conceptual study, with the animated video and with a conceptual study, and then we will give you a lot of practice ECG, because this can be confused with some kind of, suppose fibrillatory waves could be there, atrial flutter could be there. So we will give you the lot of things which can be confused with AFib, so that you become expert. And another one is atrial flutter. What happened in atrial flutter? Now look, here some pathway will develop, circular pathway. Here there will be depolarization of atria, there will be normal conduction, but some impulse will start rotating in the right atrium in a circular manner. आप यहाँ ध्यान से देखना, focus at this portion carefully again. These are very fast. So that means they are depolarization the atrias at very fast rate, and these are the P wave are getting fused to form flutter waves, and some of these will get connected to the ventricle and produce a normal QRS. So how it will look in the ECG? It will look like a sawtooth shape. Sawtooth shape. You know ना saw क्या होता है, ठीक है ना? ये. So sawtooth shape. If you see sawtooth shape, that means here 1, 2, 3, 4. Atria is beating 4 times faster than the ventricle, and out of the 4, only one conduction is being passed. So this is 4:1 conduction. Atrial flutter. Don't get it confused with AV block. Okay, and this is the atrial flutter. It could be a regular. It could be variable. 4:1, 2:1. Okay, 2:1 and 4:1, like this. So that was almost everything. This was, you will also can see this kind of atrial flutter, 2 flutter waves, 2 flutter waves, then 4 flutter waves, and 2 flutter wave, 4. So we will call this as regularly irregular rhythm. Neither it is AFib was irregularly irregular rhythm. This is regularly irregular rhythm. So A flutter can be both regular and regularly irregular both. So that was enough for today's session, and I think I complete this much in a week. So today I have to fast at go at a very high speed, and
Fruits संख्या में.
now let me check the chat. किसी ने कोई डाउट पूछना था तो you can type down ना, if somebody has to ask. हटा देते हैं इसको. If somebody want to come face to face, then he or she can come. So during the journey of 30 to 40 days, we are going to start ECG learning program. So you will get a flexibility of timing. Okay, you will not get long notes or theoretical concept. There will be only conceptual study and a lot of ECGs that I have from my collection. And those ECG you will not find anywhere on either website. I have a collections of that typical ECG. If suppose there is a 2:1 block, then there could be variation. There could be MAT along the CHB. So these kind of collection I have. So I'm going to give you those kind of collection that after you will get exhausted, your mind will get exhausted by looking at those kind of rhythm. Then when you go to the clinic, you will see the rhythm in one minute. You will tell your consultant, this is this rhythm. आप क्या बोल रहे हैं? You might have seen कि MDs आपस में discuss कर रहे होते हैं, ये है, ये 2:1 है, नहीं ये 3:1 है, ये CHB नहीं यार ये है. You will go there. You may be simple person. Maybe you will go, how can it be 3:1? This is the CHB. Look, this is not आपका एक sentence. If you learn from here, this is not I'm saying. ऐसा हुआ है, लोग यहाँ से people have learned from here. Simple resident जो MBBS पास होते हैं, they have gone and just started telling the FD3, yeah, you can start discussing with HOD with confidence, because they develop confidence in these 40 days. So during this 30 to 40 days journey, I'm going to give you experience of my lot of experience of my career that have concise in a very typical manner, and not a kind of I don't believe in writing books and theory. I believe in practical things. So at the end, you will feel that you become very expert, and lot of people are there which I have developed good relation with the students. With lot of people. Even I don't remember their name. Sometimes they call कि मैं चंडीगढ़ आया हूँ, मेरे से मिलो, मैं जलंधर आया हूँ, तो मैं चंडीगढ़ होकर आया हूँ, आओ क्लिनिक पे मिल के जाते हैं. आई सी की पता नहीं कब पढ़ाया था मैंने, कौन से बैच में, आई डोंट नो. तो लॉट ऑफ अच्छा लगता है, एक रिलेशन बनता है. इट्स माय दैट्स व्हाई आई हैव नॉट इस प्रोफेशन में नहीं बदला मैंने टीचिंग को. इट्स माय पैशन ओनली. सो एनीबॉडी हियर? तो मेंबर, ये तो सब रहा आज के सेशन के बारे में. तो मेंबर who some member have already joined and other should not waste the time. If they like, they must inbox me and just ask me, and let us stop the recording. Please do plan eco class, sir. Sir, Dr. Iman Angole, I have told you now, at least I need a proper strength, then I will start eco program. Right now, I have some students also. So I have written their name and number who are ready for. Once I have enough strength of the member, then I will start the eco. Because what happened at the time of eco, when you start up, some people say that मेरा exam आगे वो आगे, फिर eco is not a thing कि यहाँ बोल लूँगा आप समझ लोगे. It's a I teach eco only to those people who has access to eco machine, who know how to what are the various views and how to do eco. Only for those people. So right now, whenever we will plan the eco, I will definitely tell you and call you. I have already noticed the name who have raised the interest in eco classes. So anybody else? So remember, if you like this session, then you can join our program. And after